Hi, everyone. Thank you so much for joining us today for this webinar, going over the main findings and recommendations from our recent study on non-traditional hours and childcare. And thank you also to First 5 LA. The study was funded in part by them. So just some housekeeping, everyone is muted. Use the questions box for any questions you may have, and we'll have time at the end for Q&A. For any technical issues during the webinar, please contact Maximo Planes. And there's a link to download the report in the chat box if you haven't already, and the slides are included as a PDF in the handout section. So my name is Gemma DiMatteo, and I'm the Research Director at the California Child Care Resource and Referral Network. And Keisha, I'll let you introduce yourself.
Hello, everyone. My name is Keisha Nzewi. I'm the Director of Public Policy here at the network.
Great. So our agenda for today, we'll start with a brief overview of who we are, go over the background for this project, review some of the main findings and insights from the study, and then Keisha will present our recommendations, and then we'll have time at the end for some questions. So a little bit of background on us. The California Child Care Resource and Referral Network, also called the network. Our mission is to inspire, inform, and advocate for a quality child care system that supports all families in California. And we're a membership organization of local child care resource and referral agencies. And in partnership with them, we support policies and programs that help families and children, as well as the providers who care for their children. And through the Child Care Initiative Project, also known as CIP, which is coordinated by the network and implemented in every resource and referral agency, we have a unique connection to family child care providers. Also, with the support of the local resource and referral agencies, our research helps to keep us and other stakeholders informed about important child care information. And because of our connection to the local communities through the local R&Rs, we can also conduct statewide research that represents the voices and experiences of California's diverse communities. And all of the network's research directly informs our policy advocacy with the intent of ensuring policies and programs are created in an equitable way, taking into account the impact they have on individuals' lives. So a little bit of background on non-traditional workforce and childcare. So almost 40% of Americans work non-traditional hours, which are early morning, evening, overnight, and weekends. And this is expected to increase given the 24/7 economy and the use of scheduling software. Non-traditional hour jobs tend to be lower wage and less predictable, and the people working them tend to have less formal education and be people of color. But we already know that finding childcare is a struggle for most families. And for those that work non-traditional hours, it can be even more difficult. Only 23% of children 0 to 12 with working parents have any kind of licensed childcare available, and less than 1/3 of that licensed childcare of those programs offer non-traditional hours. So part of the impetus for this study was a project that T-Lab at Tipping Point and the Restaurant Opportunities Center did, investigating the experiences of parents in the Bay Area working in the restaurant industry. And they discovered this phenomenon of the poor subsidizing the poor, since most childcare was done as a favor by people in the community who didn't necessarily have the time or resources to be providing it. And this issue is too generational, as lack of stable care impacts the parents' economic security and mobility, as well as the child's development. So this study is the first on this topic to include all of California, be open to parents in all industries, and also focuses on the experiences of the child care providers who work non-traditional hours. This study was exploratory and used a human-centered, design-inspired approach to really listen to the experiences and needs of both parents working non-traditional hours and the providers who care for their children to create policy recommendations that help both populations. So we used three methods of data collection. We had online survey, which was distributed statewide, and in-person focus groups and phone interviews that spanned 8 counties, including at least one in the Northern, Central Valley, Bay Area, and Southern regions. And with all methods, we reached a total of 1,220 participants. So these are the survey participants. There were 1,134 total. 624 took the parent survey, and 510 were providers, took the provider survey. And the survey was offered in English, Spanish, and Chinese, and you can see the language distribution here. So for the focus groups and interviews, we had a total of 86 participants. There were 29 parents, 53 family child care providers, and 4 license exempt providers. And the focus groups and interviews were offered in English or Spanish, and you can see the distribution here. So I'll go over some of the main highlights from the results, but this is not comprehensive and there's a lot more detail in the report. So we're going to start with the survey results, and these are from the parent survey. So the top 3 industries parents worked in were customer service, healthcare, and retail. And along with working non-traditional hours, 70% of their schedules were also variable, meaning they changed every day, week, or month. And that was out of 524 respondents. And when asked how much notice they were usually given, almost 40% were given less than 1 week notice, and just over 40% were given 1 to 2 weeks. That's out of 363 people, and that means that about 80% were given less than 2 weeks notice. So the majority of parents had a family member, friend, or neighbor watching their children. There were also a fair amount in a family child care home, some with a babysitter or nanny, and then less in a center. And this is out of almost 500 parents. So we asked parents to rate their satisfaction with their child care arrangement, and then we stratified by the type of provider they had. We found that those that with a family child care provider reported the highest overall satisfaction. You can see here it's pretty left skewed with the majority in the satisfied side. The largest proportion is very satisfied, and this is out of 130 respondents. So this is the responses from parents with a center. This is responses from 60 parents, and you can see most are still satisfied, but there's more in the somewhat satisfied and less in very satisfied. And so these are the responses from parents with a family, friend, or neighbor provider. This is out of 340 parents, and it starts to smooth out a little bit here with more results in the middle. And these are parents with a babysitter or nanny, and this is out of 92 responses. And you can see there's a little more in the dissatisfied area here, and there's just over 10% very satisfied. So when asked which childcare arrangement they would prefer, the top choice was a licensed childcare center, followed by a licensed family childcare home. And this is out of 433 parents, and they were asked to rank these options. We also asked parents how childcare affected their work, and this is out of over 400 responses. 78% said they had to give up shifts or miss work due to childcare issues, 62% had to give up a job offer or quit a job due to childcare, and 39% said they'd been punished at work due to childcare issues. So these are some direct quotes from the parent survey, and we're going to have Sherry read these parent quotes for us.
So right now I'm juggling taking time off, hiring temporary sitters, and sneaking my baby into work at the risk of being disciplined or sent home. It has been very challenging finding care during after hours that most daycare facilities offer. My family has helped me a lot, but it isn't stable and I don't feel the most comfortable leaving my son there. Having to rely on family or family friends can be hard as they have their own kids or plans, and it doesn't always fit with what I need coverage for. Sometimes having to piece together times and care with different people, it can be really stressful. Always piecing together who would watch my kids. No one in my family wanted or deserved to have to watch my kids all night, every night I worked. Lots of flaky sitters and no backup plan causing me to almost lose my job. No daycare centers open overnight or early in the morning left me with very little options. I had licensed in-home care. She worked in a hospital setting in the past, so she understood my schedule. She let me drop off early and pick up late and made her schedule around my work schedule. It was the best experience I could ask for. My family childcare provider would go above and beyond to have my children well. Arriving tired and frustrated, she would have something positive to say about my kiddos. That would make my day. Plus, she was available upon my variable schedule.
Thank you, Sherry.
Yeah.
So now we'll look at responses from the provider survey. So most providers who took the survey were family child care providers, and almost all were paid. And you can see here they were paid with a mix of subsidies and out of pocket. So the main reason providers decided to start working non-traditional hours was because families at their childcare business needed it and they wanted to help. And this is consistent with what we found in the focus groups and interviews as well. So this is out of 353 respondents. When asked how much notice they usually got between the family giving them notice and providing care, over 40% got no notice to a few days, and almost 40% got a few days to a week. And this is out of 273 responses. When asked to rank the main challenges they faced in caring for children during non-traditional hours, the top challenge was interference with personal time, followed by interference with family time, and then low pay. And this is also consistent with the focus groups and interviews. And again, this is out of 343 responses. When asked what would help them in an open-ended question, the most frequently cited response was more pay or higher reimbursements, followed by having an assistant or extra help, which is presumably also related to higher pay. And then next was consistent schedules and sufficient notice from parents. And this is out of 199 responses. So these are some direct quotes from the providers from the survey, and we're going to have Rainbow read these for us.
Okay. I sleep less, but it is worth it because I'm able to have more kids throughout the day. But it's hard because I have to work a lot of hours to be able to pay my assistant and my bills. If we could get a better payment for these hours, we can pay assistants more hours and be able to rest a little more. It's really hard to do anything with your kids because it really leaves no time for that. There are no incentives to take care of children at this time. No program offers anything extra, or some special class for us as motivation or personal improvement. The thing that would be most helpful to me in order to not experience burnout would be to have more paid days off through the subsidy system. 10 days for a whole year is not enough. Working non-traditional hours takes a toll on one's well-being and family life, and when the reimbursement comes from a subsidized source, it is not worth it most of the time. It can be fulfilling when no one sees their child care families thrive and accomplish their goals. Working non-traditional hours can be exhausting and can also hinder family relationships between the provider and their family members as they are busy caring, cleaning after, and prepping for their child care children. It was fulfilling to help families in need. It was temporary, so not too bad, but it was exhausting and my family suffered.
Thank you, Rainbow. So these are the main findings and results that we found throughout the focus groups and interviews, and these are the main themes that emerged really throughout all of them. So, and these are from the parent results first. Parents with a family child care provider were extremely grateful for the flexibility and warmth with their children, and many of them saw them as a second parent. Parents with a child care voucher expressed experiencing limited access to programs, and because there's a lot of disincentives for the programs to, within the subsidy system, for the programs to take children with subsidies. For example, programs don't get reimbursed until the end of the month for a child with a subsidy, compared to a private paying child, they get paid at the beginning of the month. Parents, this is a little more complicated and we'll go into it in the recommendations, but in general, parents can't use license exempt vouchers for care in their own home. So parents have to transport their children to the exempt provider's home, often waking them up in the middle of the night and disrupting their sleep, and doesn't allow the children to sleep in their own beds. Transportation is difficult for a lot of school-age children and other children as well, but a lot of parents express difficulty getting their school-age kids from school to childcare or childcare to school, and parents wish there was some sort of affordable rideshare service to help with this. Many parents often got very little to no warning about their schedules, meaning that they couldn't give their providers any advanced warning either. So the parents are trying to maintain good standing at work, and they'll be punished if they can't take last-minute shifts or have to leave work early. So the providers take on this flexibility so that the parents can work. And often the parents don't know what time they'll be done for the day until they're told they can leave. And so the provider also doesn't know what time the kid will be picked up. So even if parents aren't outwardly punished at work, they often get passed up for promotions or job advancement by employees with no children or who have another adult at home or some stable childcare during those hours who can accept those last-minute shifts during the non-traditional hours. And we saw that sometimes, usually with center programs, the parents' work schedule would be barely outside the hours of operation for the center. But if the parent didn't have someone to transport to and from, they would have to just take their child out of the program or quit their job or cut down their hours. There was one single mother in a focus group who had her daughter in Head Start and really loved it, but she had to be at work 30 minutes before the Head Start program opened, and she ended up having to take her daughter out, and she was pretty sad about that. So similarly, Head Start and other center-based programs that are meant for the most vulnerable families are often not accessible to families working non-traditional hours, especially those with a single parent. So we're going to, these are direct quotes from the focus groups or interviews, and we're going to have Sherry read these for us.
So I'd be off at work 11 p.m., 12 a.m. When I would pick up my child, it's the middle of the night and they're asleep, and to have to get them home is difficult. The grant was great, but a lot of people didn't accept it because they don't get paid right away. If I wanted to use the grant, I'd have to pay upfront fees to cover costs, so it was on the books when they didn't get paid. I respect the grants, but it makes it hard to find a location that's willing to work with it. I never understood why you can't have a provider or a relative come to your home. I typically try to have my kids get ready for bed between 8:30 and 9 p.m. So getting them out the bath and into pajamas and then dropping them off somewhere and then having to get them in the morning, get them dressed, barely see them, and drop them off at school, that's a lot. I think it would be a lot more convenient and comfortable if they're in their own beds. So I don't understand why this subsidy program doesn't support that. Ideally, I would have someone come to me so I don't have to disrupt my kid's schedule. Right now, I'm relying on family. My mom is my provider.
Thank you, Sherry. So these are the results from the provider focus groups and interviews. And these are the main takeaways and findings that we saw throughout all of them. So the main reason why providers started working non-traditional hours was because the families that they were caring for needed it and they wanted to help them. Nobody mentioned trying to extend their hours to increase enrollment or revenue. And this is similar to the survey results as well. A lot of family childcare providers described working 12 to 24 hours a day, 6 to 7 days a week, to accommodate all of the family's work schedules, which were often varying. So also consistent with the survey, providers surprisingly expressed a lot of satisfaction with working non-traditional hours, although they also expressed exhaustion and burnout. And it's because they get a lot of joy and fulfillment from the job. They really love the children in their care and they see them as part of their family. And they see the families also as part of their family. And this makes them feel obligated to accommodate the family's work schedules because they're attached to the children and they want the parents to be able to work. We also found that family childcare providers often act as a community hub, and they expressed a lot of gratification from helping the families in their community, especially single parents. Some family childcare providers described helping families experiencing homelessness by letting the kids stay in their home or helping the family get an apartment, and they'll often provide resources like diapers or referrals to outside resources. So working long hours, this is with family childcare providers, interfered a lot with their own family time, which caused regret and sadness in the provider and some anger or resentment from their own children or their spouses. A lot of family childcare providers said they went into this job so that they could stay home and take care of their own children. But working non-traditional hours, they realized that they had less time with their children than if they had found a job outside of the home. So across the focus groups, older family childcare providers whose kids were grown and maybe they lived alone expressed an easier time providing extended hours and non-traditional care, and a lot of them enjoyed it. They liked having kids in the house when otherwise it would be empty. But for family childcare providers with young children at home, it was a much bigger burden because it detracts from time with their own children and families. So most providers expressed feeling some amount of burnout and that they were tired while working on traditional hours. A lot of them did it in the past but stopped working these hours because they just got too burned out or they were planning on stopping soon. And the main reason is because they just needed some time to rest so that they could be more present caring for the kids when they are working. We also noticed that the few license exempt providers we talked to were already providing care for the kids. They weren't relying on the reimbursements as income, but the reimbursements were a sort of an added bonus. A lot of providers said that their main challenges, or one of their main challenges, that they have no time for themselves, including the ability to schedule doctor's appointments, and that their health suffered as a consequence. Family childcare providers, a lot of them said they would like to work only the non-traditional hours, so maybe only do night or overnight or weekend care, or only do traditional hours. But often there aren't enough families who fit into one of those categories in their area, especially when the parents' work schedules are varying week to week or month to month. So another thing we noticed, family childcare providers consistently mentioned disincentives and drawbacks to taking children with vouchers, and we saw that the parents also experienced this on their end. But providers can charge private pay families more if they ask for non-traditional hours of care, whereas with children with vouchers, they often don't make significantly more money working those hours, and it ends up just not being worth it for them. In areas where providers have a choice, a lot are trying to transition away from children with vouchers and trying to only enroll private paying children. And providers, there were a few providers who only had private pay families, and they were the ones who tended to only be open during traditional hours and had better boundaries and work-life balance. So when asked what would help them, providers described the following. So this was very frequently mentioned, but higher reimbursements during non-traditional hours, or for working, for example, more than 8 hours a day, like overtime, so that working these extended hours was worth it, and so they could afford to hire an assistant. They also mentioned vacation and paid time off as being very important and helpful for them. And there were some communities where providers had created a network of other providers to help cover them when they're gone. So in some communities, there were one or a few family child care providers who would do the extended hours, and they were working often like 24 hours a day, up to 7 days a week. And they would take referrals from other providers who only wanted to do more traditional hours. So, for example, there was one community where there was an older family child care provider who lived alone. She would take other providers' children during the weekends so that those providers who had their own families at home with young children could take the weekend off. Providers mentioned that it's easier to provide overnight care, so to have the kid there the whole night rather than have children picked up at all hours of the night or dropped off at all hours. And late night and early morning pickups also wake up the children and make it hard for the providers also to get the rest they need to make it through the long days. Providers also mentioned that they wish there was better communication between the alternative payment program staff and parents. So these are some quotes from the providers from the focus groups and interviews, and we're going to have Rainbow read these for us.
Okay. Private families are better, pay better than subsidy. I work almost 24 hours a day. It's very burdensome. I almost lost my house because I wasn't making enough watching children. I had to get another job preparing for quinceañeras on the weekends when there was no kids. The subsidy program doesn't pay for these hours, and it's not worth it to work all these hours for the same pay. I can't go to appointments because the families rely on us. I'm diabetic and I need to go to the doctor. I didn't go to the doctor for a whole year, and I didn't have a mammogram for 5 years. I think it was rewarding for me because I was helping the community, helping the kids. The challenge is being there for the families because they're working, and I felt like if I wasn't going to do it, where would they go? It would have made it easier if I had help and just did certain hours and not so many weekends. I felt guilty because they'd come to me and say they have to work. Can you please watch them? And I felt bad, so I was like, okay, I'm here for them. So I just did it, not knowing the toll it was taking on me and my family too. It was so consuming for my time and my life.
Thank you, Rainbow.
Hmm.
So now we have Keisha, who is going to go over the policy recommendations.
So you've just enjoyed a lot of information and data about providers and families in California and how they struggle with needing and providing non-traditional hours of care. But prior to our study, the Assembly's California Blue Ribbon Commission on Early Childhood Education also held hearings and focus groups with Californians and developed recommendations. So we want to acknowledge that they too recommend that California expand programs that are available during non-traditional hours and that are responsive to flexible schedules. And the BRC also recommends that incentives be provided to encourage this type of care and that we remove barriers to offering it in order to encourage providers to keep providing it. And so, as you can see, our study is in line with the BRC findings as well and just reinforces these needs. Furthermore, in 2014, with the reauthorization of the CCDBG, the final rule of the Child Care and Development Fund, CCDF, which pays for subsidy and quality and whatnot, in those regulatory changes, it reiterates that families utilizing child care subsidy should have access to at least 75% of all available child care. And so in order to do that, we need to make sure that they have access in all the hours of the day that they need it. So our first recommendation has to do with how providers are paid. And as we heard from the quotes in this study, providers struggle because they aren't paid necessarily more to make it worth the extra effort to work non-traditional hours, but also compared to private pay families, they're paid later and in a different way. So we recommend that providers who accept subsidies should be paid in alignment with how they receive payment from private pay families, which means if you've ever had children and had to pay for childcare, you know that you pay for childcare at the beginning of the month and you pay for the entire month, no matter if your child is out sick or you just miss a day here or there for whatever reason. Our current system reimburses child care providers who accept subsidy based only on the number of days the child attended, and also it's after the care is provided. So we would rather that providers are paid on a monthly basis at the beginning of the month so that they too can enjoy a stable income and they don't have to advance costs ahead of time that they may or may not be compensated for, which also allows them to plan better for their childcare program and helps prevent the poor subsidizing the poor, as many family childcare providers especially are low income themselves. Now, it was mentioned more than once the importance of a child being able to sleep through the night and the provider being able to sleep. So our first recommendation regarding that is that license exempt providers should be able to provide care in the child's own home. Now, and that was a very consistent theme, that providers and parents want their kids to have a good night's sleep that's uninterrupted. But because of the Fair Labor Standards Act requirement, it doesn't allow license exempt providers to provide care in the child's home unless they are being paid minimum wage. And if the provider is being paid using child care subsidy, they would need to care for enough children so that the subsidy rate reaches the minimum wage requirement. But because of that, the parent would either, especially if they only have one or two children, would need to pay a co-payment to bring up the wages to minimum wage. So there's currently no place a child can receive care and be able to sleep a full night if that parent's schedule doesn't allow that. So we offer that child care license exempt providers, should be able to care for children in the child's home when overnight care is required. And so there's been a lot of work around rate reform in California, and we urge that as part of ongoing rate reform efforts, a solution should be sought that results in license exempt providers being paid no less than minimum wage for the hours they provide care without that added burden on families. So without the family having to make up the amount being paid to ensure that a license exempt provider is being paid at least minimum wage. In this way, children will get the uninterrupted sleep they need, providers will have stable income, and parents will have less stressful situations trying to find care. In the same vein, licensed providers should be able to care for a child the entire night if agreed upon by the parents and providers. As one of the examples illustrated, sometimes a parent may go to work super early in the morning or very late at night, but not at the beginning of the night when it's a child's bedtime. So for the same reasons that license exempt providers should be able to care for a child in their own home, a licensed provider should be able to care for a child the entire night so that both the provider and the child can get the uninterrupted sleep they need, and allowing providers to be well rested for the next day when they're likely caring for children during traditional hours. Our next recommendation is that providers should receive paid vacation and sick and safe time, which also is in line with the Blue Ribbon Commission recommendations. Our providers, as you saw in the responses, work very long hours and have little to no time to recuperate in between caring for a child during the non-traditional hours and then preparing for the regular traditional hours. That obviously takes a toll on their health, their well-being, and even their relationships with their own families and ability to care for their own families. So there should be a mechanism in place that providers who receive subsidy payments should be able to take paid vacation time and sick time. For example, if they have work a certain number of hours, they can accumulate a credit of an hour that they can claim that will then cover a substitute so that they can attend their health appointments or take time off that they need, or have ability to tap a certain number of subsidy-sponsored substitute pool hours at no cost to the provider or the parent. Another recommendation is that California should support a shared services model to support the business practices and operation of providers. And that would allow them to focus more attention on just providing quality care. So in a shared resources model or a shared services model, providers work together to share or pool resources. So in the case of time off, if they're in a shared resources model, they can depend on one another to care for children who might be impacted by their time off. And so there's already a built-in mechanism so that parents still have a place to take their children for care when their provider has a doctor's appointment or has another reason to take time off. But it also helps, the model also helps small business owners with their business practices, such as enrollment, or billing and the subsidy reimbursement process, being able to purchase items by pulling together and making larger purchases, which usually results in discounted purchasing, but also peer technical support and professional development. And this just helps providers be able to stay in business for as long as they want and be successful in that and continue to provide high quality care. And in fact, also supporting this recommendation, the final rule of the CCDF requires that states do encourage public-private partnerships like the shared services model, so that at the very least, at the bare minimum, providers can share their resources, pull together their resources to pay for fixed costs. Another concern that parents expressed was long commutes. That's a very big challenge for a lot of us. And parents who do receive childcare subsidies are allowed to request commute time for each way. But it seems the study suggests that many parents and providers don't know that they're allotted that time necessary to get to and from work. So that results in providers being underpaid, meaning that they're caring for children beyond the number of approved hours because a parent can't pick them off or drop them off at the time that is allowed with their subsidy. And that makes providers really frustrated because they're working for much longer than what they're being paid for, and again results in the poor subsidizing the poor. And so we recommend that actual commute times be included in the amount of care a family is able to utilize, and providers should be paid for the actual amount of care they provide. If that care exceeds a normal workday, then the additional commuting time hours for commuting should be paid at a higher rate, similar to private pay families, how they pay their providers. We don't expect people to work for free, and the same should be applied to childcare providers. Now, a very strong theme through this study is how much providers are paid for non-traditional hours and how that oftentimes makes it not worth it for them. It's very difficult to provide care during this time, but it's a huge burden because of the poor pay for providers who are receiving payment through the subsidy system. So while providers do receive higher rates for caring for children during non-traditional hours, that rate isn't high enough to incentivize providers to work during those hours. And again, in the final rule for the CCDF, it requires states to build supply for children who receive care during non-traditional hours, and it suggests that one way of doing that is to increase rates to levels that are sufficient enough to meet any higher quality standards associated with that type of care. But unlike with private pay families who are charged a significant amount more for care during non-traditional hours, providers who accept subsidies don't see a big enough jump in their income or a difference in their pay for the extended hours to be worth it, which leaves a gap for low-income families interested in using licensed care for their non-traditional hour care. So when providers care for children overnight, they have lack of sleep because subsidy rates don't allow them to hire an overnight assistant. And that's why we heard in some of these quotes that providers are working nearly 24 hours without any substantial sleep themselves. But with adequate pay, they would be incentivized to provide this care. They would be able to potentially afford to hire an overnight assistant or an assistant during the day, so that they can get the sleep, the provider herself can get sleep she needs to safely care for the children when they're in her care. We also heard that there, in many cases for families, for parents, for providers, the communication and the understanding of how the alternative payment works can be confusing. And so we urge that there be mechanisms put in place that make sure that parents and providers in AP programs are on the same page, so that parents and providers have a consistent understanding and mutual understanding of the AP program, which will then avoid unnecessary confusion or conflict. And we feel like AP programs can work together throughout the state to perhaps develop a checklist of what parents and providers can expect from the alternative payment program, as well as what parents should expect from the provider and vice versa. And by facilitating that kind of clear communication, then providers will be less likely to feel taken advantage of or frustrated. And And combined with all the previous recommendations, parents will feel that they're receiving the care that meets their needs. And then finally, we recommend family-friendly workplaces be put in place throughout California. Parents over and over expressed fear of losing their jobs or already have lost employment due to childcare challenges, or couldn't accept or have been prevented from receiving an advancement in their jobs because of childcare challenges. So employers can support their workforce by providing stable schedules so that parents know far in advance when they would need care, so then they can let their childcare provider know. Unlike the examples in our study where sometimes they didn't know until the day of, or many had less than a week's notice, because parents and providers need to plan for that care. And then employers can provide childcare assistance by helping their employees find and use their local childcare resource and referral agency, or contract with their local R&R to help employees identify and find the care that best meets their needs. Employers, of course, could go even further and support a pool of trained, trust-lined, registered providers that parents can call upon to use. And going even further, they can offer scholarships to help pay for childcare, or pay for the additional costs that families incur when they need care during non-traditional hours, which would benefit the family and pay providers the actual cost of care. And then finally, employers could also provide on-site licensed care or contract with licensed providers for nighttime care. So they could contract with a licensed provider for certain spaces, for a certain number of spaces that their employees would then have direct access to. And that concludes our recommendations.
Great. So now we're going to open it up to questions. So if you have any questions, please type them into the questions box. Sherry, do we have any questions so far?
Yeah, it looks like we have a few questions. So the first one asks, what are some of the ways that these policy suggestions can be addressed?
Sherry, can you repeat that? I'm sorry.
Yeah. What are some of the ways that these policy suggestions can be addressed?
Well, the biggest way is for all of us to make sure our policy makers hear these challenges that providers and families have, and that we advocate for these policy changes. These recommendations are the R&R Network's top priorities in our policy platform for 2020. We know that we can't get all of these recommendations passed or changed through regulatory process or whatever is necessary in just 1 year. But we do know that in this year, we will be focused on asking for these changes in the context of legislation or budget, wherever is appropriate. But we also have to recognize that this year is different in that our governor is working on an early care and education master plan, and may or may not make any changes this year until the work of the master plan concludes. But no matter this year and going forward, we'll all work hard together to make sure that we put these changes in place because families and providers need it.
Okay, great. This is a question from a provider. How can providers advocate for more pay for non-traditional hours?
Again, just like I previously said, we need to be in Sacramento and really pound the pavement to make sure that all the folks that are in position to make these decisions and make policy changes know that this is a priority that can't wait. And we're really excited, the network this year, that we've received funding to help bring, in many ways, the R&Rs are the only folks in the Capitol who are regularly able to bring the viewpoint of the home-based provider to these discussions. But more often than not, home-based providers aren't there to speak for themselves. So we're very excited to have funding for this coming legislative and budget year to be able to bring home-based providers, family child care providers to Sacramento in partnership on our R&R Day in the Capitol, which is a big advocacy day, and also through the budget hearings and legislative hearings to be able to speak for themselves and to be able to share these same types of stories and whatnot directly with their elected officials and directly in budget hearings and bill hearings, so that we can't be ignored any further.
So this is sort of a follow-up question. How can we advocate for more resources for flexible childcare options for working families?
I think in combination with Parent Voices, which is parent-led, parent-driven advocacy group with chapters up and down the state of California, in partnership with R&Rs and with our home-based providers this year, by beating this constant drum in the Capitol is the only way. It's not going to happen just because, it's going to happen because we make it happen.
And do we have enough data to support our ask? Ask the same person.
Yeah, so given the reach we had with this study, we had over 1,000 responses, and the fact that we saw, the themes that we saw were consistent throughout all of the focus groups and interviews, and also between the focus groups, interviews, and the online survey. We believe that the data is robust enough that we can use this to advocate for the recommendations.
And it looks like this is the last question. If your county participated, can we get the results for that county only for this report?
Yeah, so if you're a resource referral agency that helped do the focus group, then you can definitely get those responses. And if you're a resource and referral agency that had a lot of responses, survey responses in your county, we can also give you those. So feel free to reach out to me and we can figure out how to get that to you.
Okay, it looks like there are no more questions for now.
Okay, great. So if you have any other questions or thoughts, feel free to reach out to me or Keisha. Our email addresses are up here. And if you haven't already, please download the report, which is on our website. And thank you so much for joining us, and have a great rest of your day.